We are going to talk about anemias and pathological details of different types of anemia. So first, what is anemia? Anemia is reduction in the circulating red blood cell mass. Now, red blood cell mass in itself, the mass of the red blood cell, it's quite difficult to calculate, but we do have other labs that we need to go through that can help us go about the RBC mass, or actually going to surrogate for the RBC mass. And these include the RBC count. So I have written it here just to go over it quickly so that you know what we're talking about. So the first is the RBC mass. So RBC count. The RBC count is the number of RBCs per unit volume of the blood. Then we have the hemoglobin concentration. So we know that concentration, we have a formula in physics that is the amount is equal to volume into concentration. So with this, the concentration will become amount divided by volume, and so that's how we have the gram per deciliter of the unit of the hemoglobin. So it's the concentration of hemoglobin in the blood. And for females, it is 12 to 15, and for males, it's 14 to 17. And then we have the hematocrit. So hematocrit is basically volume of RBCs divided by the volume of blood. So we need to know in hematocrit that how much space or how much volume does the red blood cell carry in the blood. So that is in blood. If you look at blood, so in blood we have RBCs, and then we have everything else is actually plasma. So RBC is 45% of this whole 100% of the blood, right? And the rest 55% is plasma. Then we have MCV, which is the mean corpuscular volume. The mean corpuscular volume is the average volume of red cells in the specimen. So this is important. This is the thing with which we kind of classify our anemias. So mean corpuscular volume, again, it is the average volume of red cells in the specimen. Now, anemia, when is there anemia? Anemia is in females when it's less than 12.5, and in males it is less than 13.5. We call it anemia. So, but there's another thing to know. In pregnancy, the mother's blood volume will increase, right? It will increase. And when it increases, it gives an illusion that the hemoglobin and hematocrit goes down. But in actuality, the red blood cell mass is constant. It is just that the volume has increased, as you see in these formulas. Right here, volume. So concentration right here, the concentration is going to be amount by volume. So here the volume is increasing. This may decrease concentration, but amount will stay the same. So that is the reason why in pregnancy there could be sometimes false reports, but that is not mostly anemia. Anemia can happen, but it might be physiological. There may be pathological conditions as well, but mostly this is what happens. Okay, then the symptoms, generalized symptoms of all anemias. We have weakness, we have fatigue, dyspnea, pallor, headache, lightheadedness, and angina. And angina is mostly in patients who already suffer from acute coronary syndromes. Now, based on the mean corpuscular volume, we have three divisions. We have microcytic anemia, which is basically, because we know the MCV, normal MCV, it is 80 to 100, right? So picometers per cube, because it's volume. So in microcytic, it is less than 80. In normocytic, it is 80 to 100, but still the RBC count is low, or RBC masses is low. And macrocytic is more than 100. So really what you need to know here, if we have it's kind of like a no-brainer. If we have a small cell, if the cell is small, the MCV is going to be low. And if the cell is large, the MCV is going to be more. So right here, what we need to know is that microcytic anemias, some general basic principles about it. We're going to go through it, and then we're going to detail all the different types of anemias in the upcoming videos. So MCV is less than 80. It is due to decreased production of HB. That's important. Hemoglobin pathway is affected. This pathway right here, this is a synthesis of heme, right? So we know how hemoglobin is formed. Hemoglobin consists of heme and globin. Globin is protein. It comes from protein. And heme consists of iron and protoporphyrin. So right here, this is the protoporphyrin or heme synthesis, right? Anywhere, any problem in this can cause microcytic anemia. So RBC progenitor cells, the progenitor cells that make RBCs are going to be big, but the mature cells are going to be small. That is why MCV is decreased. There is another concept that there might be microcytosis, which means that there is an extra division of the cell to maintain hemoglobin. Okay, next is the normocytic anemia. The normocytic anemia, it is, the normal MCV, but there could be increased peripheral destruction, or it could be due to underproduction. And how to differentiate that, whether there is peripheral destruction or there's underproduction, we look at the reticulocyte count. I'm going to detail about, in very nitty-gritty details in upcoming videos when we talk about normocytic anemias. Then we have the macrocytic anemias, in which the cell size is large. So we have MCV that is more than 100. It could be due to folate deficiency or due to vitamin B12 deficiency. And mostly it is because of the impaired synthesis of the DNA precursors, so because of this, we have the RBC precursors that is, large and with impaired division. And also because there is impaired division of granulocytes, because there's folate deficiency. So our white blood cells will also be hypersegmented. So we will have hypersegmented neutrophils. And that is why we call it the macrocytic anemia. And also megaloblastic change is also seen in the intestinal cells because they're rapidly dividing. And this is the pathway through which we find the folate is used in the pyrimidine and purine synthesis. So you see the folate is utilized in 2 to 3 steps, like in this step for salvage pathway, and then the thymidylate synthase. All these pathways, the tetrahydrofolate or the folate trap synthesis, we're going to detail in the biochemistry lectures when we talk about purine and pyrimidine synthesis. Okay, that is it for this video. And in the next video, I'm going to talk about the microcytic anemias.